Today, we're going to be discussing occupational therapy's role in mental health. We're going to be talking about post traumatic stress disorder. What is PTSD? Post traumatic stress disorder is a trauma or stress related disorder that develops following exposure or witness to a life threatening event of oneself or others. When I say PTSD or post traumatic stress disorder, who does that bring to mind for you?
Veteran.
Veterans, yes. I would agree that often when we hear PTSD, we think of veterans, we think of our military personnel, and that is true. PTSD definitely affects our veterans at a high rate. But did you know that PTSD can also affect children, adults, the elderly? It could affect women, men, it affects everyone. We're all affected by some form of stress, and we all experience some form of trauma.
Okay.
So when I say trauma and traumatic events, I'm speaking of anything that is personal to the individual. So this could be an experienced event of physical abuse, sexual abuse, or emotional abuse, or it could be a medical incident, a vehicular accident, a catastrophe, a natural disaster, imprisonment, capture, or more. It's whatever the person who's affected by the trauma feels it is. It's really personal to what you, as the individual who's experiencing the trauma, feels it is. So when I say a traumatic event or a traumatic occurrence that has occurred maybe in the past year or so, is there anything that comes to mind for you?
It would be COVID.
COVID, yes. So it has affected everyone, especially in the past year or so of our lives. It's something that started off, or we felt it started off very small and minimal, but it has grown into a phenomenon and it has impacted our way of living. Some of the symptoms that you may have experienced during COVID times or from any other type of traumatic events that occurred in your life could be significant distress, difficulty engaging in activities, loss or difficulty maintaining relationships, and also there's an increased probability of self harm. So, I want to tell you some ways in which occupational therapy can actually help decrease your stress and actually improve post traumatic stress disorder. So, one of the ways in which occupational therapists can help is by having discussion regarding childhood trauma. So, if there's any traumatic events that have been unsettled or that are impacting your life as you develop and grow older, we can have discussions about that and try to work through some of those events. We can also help you identify trigger and warning signs of stress. We can help you stabilize symptoms. I can also help you in developing coping and wellness strategies. I can educate you and train you as well as the public regarding what post traumatic stress disorder is and how it can be treated, and also, um, just kind of the different ways we can help regarding post traumatic stress and stress in general. I can also help you increase your occupational participation.
What is occupation?
I'm glad you asked. So, occupations are activities that we complete every day that we find meaningful.
Okay.
We can also help in modifying your home if required. We can have group or individual sessions for counseling. And we can also promote veteran awareness. So, we can promote veteran awareness and the impact of war and how that has created a development of post traumatic stress disorder. And ultimately, our aim is to help you improve your quality of life. Thank you for meeting with me for this session. I'm looking forward to working with you next week. If you develop any questions from now until then, just please let me know.